When I was a young intern, I used to have to take call. And at that time, call was generally 36 hours on, followed by a day or two of no call, which was just a regular work schedule, generally from about 6 in the morning until 6 or 7 at night. And then every second or every third day, we worked overnight. So it could be anywhere from 36 on, 12 hours off, 36 on, 12 hours off, to 36 hours on and 36 hours off. But there was always a long stretch in there where I had to stay up all night. I was young and I was previously pretty healthy. And at first it wasn't that big a deal to me. But over time, everybody started to feel like they had the flu. And we all noticed it. At first it was just kind of sandpaper in the eyes, but later it began to become more severe. And we started to experience back pain, muscle aches, flu-like symptoms. And once these symptoms started, they really never went away until I started getting decent sleep at night. I switched from being an intern to moving up a year and becoming a resident, where I started to get more sleep. I had to stay up fewer hours. I was able to reduce my schedule from 36 hours to 24 hours, and most of my symptoms resolved. The pain that I experienced didn't develop immediately. It actually took 2 or 3 months to begin to develop, and it started on rather insidiously. I felt it as ache. I felt malaise. I just didn't feel good. That feeling you get when you just want to crawl in a cave and curl up. I also had trouble getting up and getting moving. If I did get a chance to lie down and sleep, when I first got out of bed, everything hurt. My feet hurt. It hurt to walk. My back hurt. It hurt to stand upright. I looked like an old man, but I was only 25 years old. I didn't have a structural problem. What I had was a system that was inflamed from the inside out. At first, I thought I'd done something. I had injured myself somehow and created these symptoms. But as I came to learn about pain, I came to understand that this was just a consequence of sleep deprivation. And I also came to learn that many of my patients experience the same thing. They have pain, they have anxiety, they have anger, their mind doesn't shut down, and they have difficulty sleeping. And this creates a vicious cycle where sleep begets pain, which worsens sleep, which makes pain worse. And you wind up with a pretty terrible problem. It's hard to understand and turns out to have a relatively easy fix. There are a lot of things that happen when you don't sleep. The first thing that happens is your HPA axis turns on. This is the hypothalamic, pituitary, adrenal axis. This causes the production of cortisol. Cortisol is a stress hormone. When you're not sleeping, this system stays switched on all the time. Now, the body needs to produce cortisol. It's a useful hormone. It's necessary for life. As I said, it is a stress hormone, and ordinarily it turns on when you need an added boost of energy. You need an added boost of stamina. You need to be able to continue with an activity for an extended period of time. Where it becomes problematic is when it stays on all the time. In the presence of chronically elevated cortisol, the microglia switch from their anti-inflammatory mode, which is considered M2, to their inflammatory mode, which is M1. They start to produce a number of interleukins and tumor necrosis factors, which further increase inflammation. These also serve to sensitize pain pathways and amplify signal transmission. Then the dorsal horn neurons, the neurons that are responsible from transmitting pain from the limbs and from the spine to the brain, get turned on, they get excited, and they get more efficient at transmitting these pain signals. At the same time, the periaqueductal gray and the rostroventral medial medulla get turned off. And so these parts of the brain, which are ordinarily working in concert to balance the excitatory and the inhibitory processes, get unbalanced, and you wind up with lots of pain input and not enough signal dampening. And these pain signals then travel unchecked from the limbs and from the spine to the brain. You can actually see this on functional magnetic resonance imaging. This is a type of MRI that allows us to look at how the brain is functioning rather than looking at static anatomy. And you can see areas of the brain, such as the insula and the anterior cingulate cortex, light up or turn on. They become metabolically active. And these areas, when they become active, connect the information that the brain is receiving to the emotional centers of the brain, and they assign meaning to the pain. And the meaning that generally gets assigned is damage, which creates emotions like fear and anger and anxiety. And so when you're tired and you start to hurt, you start to become frantic because you can't get out of pain, you can't get enough rest, and the brain fires up and starts amplifying all of these signals, making the pain feel worse, creating emotions around the pain that further amplify the signal. And again, you wind up in a vicious cycle. It's like the emotional brake pads wear thin and they start to squeal every time you apply the brakes. You have the production of these cytokines in the microglia that I talked about, TNF and variety of interleukins, and they create a sick behavior. And it's the same sick behavior that you see when somebody gets the flu. This central inflammatory state makes you want to curl up in a ball in a dark room and go to sleep. And when you have illness or injury, this is actually protective, right? The body wants to be able to get some rest. So it makes you feel like you can't do anything else than go lie down and get rest, except that the situation won't allow it. You're required to stay up and keep working and keep pushing. And this isn't really unique to interns or residents or busy doctors. It happens to everybody in the world. It happens to everybody in the United States of America. We're all sleep deprived. I had dinner with a sleep doctor a few years ago, and he said that the average person walks around with about 40 hours of sleep deficit, and the average doctor in training has about 100 hours of sleep deficit. And when you have sleep deficit, it's like having deficit in a bank account. You can't leave it there forever. It doesn't go away. If I withdraw $100 that I don't have from my bank account, I have a negative $100 balance. If I withdraw 100 hours from my sleep bank, I have a negative 100 hours. And at some point, I've got to replace that. And if I don't, I'm going to feel crummy the whole time. How do we know about this sleep deficit? Well, you can take people, just anybody, put them in a dark room with nothing to do, and they'll sleep. And most people will sleep and sleep and sleep and sleep until they catch up on their sleep. And then they'll restore sort of a normal sleep-wake cycle where they sleep for 8 hours and they're awake for 16. And at that point, you know they no longer have a sleep deficit. And most people have to replace about 40 hours of sleep before they start to feel better. So if you're feeling crummy all the time, it may be that you lack sleep. As I said, eventually I stopped being an intern, I graduated, and I moved on. And sleep deprivation became less of a problem. My schedule changed, I had more time to sleep, and most of my symptoms resolved. That's how I understand it. And that's how it's easy for me to recognize. I've lived it. So what happens when you start to sleep? Well, everything goes in reverse. The microglia revert from M1 to M2. They stop producing the pro-inflammatory cytokines, and they start promoting central nervous system repair. Melatonin production restores to normal. Cortisol production gets suppressed, and this supports tissue recovery. There's a system called the glymphatic system, and it starts to clear all the metabolic waste from the glutamate production and the substance P production. And this further normalizes the nervous system. And then you restore normal sleep-wake cycle, you restore normal sleep phases, you go back into REM sleep, and this normalizes the cycle of dopamine and serotonin and norepinephrine, and everything gets back to normal. At the same time, the prefrontal cortex starts to normalize function. It shuts down the amygdala and the anterior cingulate gyrus, and this restores normal brain function. It allows a return to normal of the usual dampening signals, and you restore the balance between input and dampening so that you can experience normal pain again, but you don't experience the heightened sensitivity and the hypervigilance that comes with chronic pain. People think that recovery means doing more, taking more pills, getting more treatment, but that's not necessarily the case. If you don't sleep, the biology can't reset and the system gets completely out of whack. Every night that you sleep well, your central nervous system switches from war mode to peace mode, and it allows for normal restorative activity in the central nervous system. And pain goes away not because the body stops talking, but because the brain starts listening. If this sort of information is interesting to you, check out painoptics.com and learn more about your pain.